People are joining us, so we will be getting started just momentarily. Okay. Okay, good afternoon. I am Carol DeAndres. Welcome to the ADRC Service Delivery Data Workshop 2. We're happy you joined us today. Again, I am Carol DeAndres. I'm a new analyst with the Quality Assurance Unit here on the CDA's ADRC team. I am a Caucasian woman. I have shoulder length brown hair and brown eyes. I wear glasses, and I'm wearing a blue floral shirt today. Today's speaker will include other ADRC team members, including Wilson Tam, David Morikawa, and Amanda Price. Also in attendance are members of the ADRC Advisory Committee's Data and Workshop. The advisory committee members that are a part of the Data and Outcomes work group include Letty Zuno, work group chairperson. She's the CEO of Access to Independence of San Diego. We have Erin Crutcher, and she is the consumer advocate and past president of the Dale McIntosh Center in Orange County. Helen Lopez, she's a member of the California Senior Legislature and Accreditation Rehabilitation Facilities. So thank you all for joining us today. I'd like to take a moment to go over some housekeeping items with you. So if you could cue the next slide. And this webinar is being recorded. The participants will be muted during the presentation, and you can unmute yourself during the open segments. Thank you very much. We have Zoom closed captioning, and you can access this by selecting the live transcript button at the bottom of your screen. You can join us in the chat feature, share your questions and comments using your chat feature on the bottom of your Zoom screen. And of course, email us at adrc@aging.ca.gov to request a copy of this recording or the presentation, or if you need technical assistance during this workshop today. So I'm going to turn it over to Wilson Tam to go over today's agenda with us. Thank you.
Yes, hi, good morning, everyone. Wilson Tam, I'm the chief of the ADRC program here at the Department of Aging. So thank you again, like Carol mentioned, for joining us today for our second workshop relating to our data collection. So today's agenda is a handful of items. We have starting off with, again, welcome and purpose of the workshop, which I'll cover in the next slide. And then we'll go into our first quarter summary highlights. So these are highlights from the first data reports that were submitted using the new updated reporting tool. And then following that would be our first opportunity for questions and open discussion. After that, we'll talk a little bit about the quarterly report review and report form clarifications. What we mean by that is really just diving into the new reporting tool and providing any additional information or clarification based on the feedback that we have received so far. Thereafter, we'll talk a little bit about future planning. So basically, after listening to our local ADRC partners' feedback today, we'll discuss what to expect in the future in terms of any improvements or anything else to expect. And second to last, we have a second opportunity for questions and open discussion. So again, after hearing the presentation and some information that we provide, if you have any further questions or feedback for us, please do let us know at that point. And lastly, just kind of wrapping things up and doing next steps. Next slide, please. So regarding the purpose, so kind of covered this earlier. So this is really, again, a follow-up to our first workshop. We do recognize the importance to obviously connect the data with our identified performance outcomes. to demonstrate the value of our ADRCs and how our No Wrong Door network and person-centered practices improve the lives of those that we touch. So with that, we're, another purpose is really to looking to highlight and answer, for today, highlight and answer questions we have received from our local ADRC partners so far, after submission of the first data reports, and to also provide opportunities for further feedback and engagement. And before we move on to our next slide, just want to also thank all our ADRC partners for all the feedback that you've provided so far, and hopefully more to come today to really help us improve our data collection and reporting processes. We recognize that this is a continuous learning and continuous improvement for our data collection and reporting. So we welcome any feedback that you have. Next slide, please. So a little bit about, I always, joke with my team, about always starting with why. Why do we do certain things? So, in this slide, we kind of attempt to answer, why are we collecting data? One reason is, again, demonstrating the value of ADRCs in our No Wrong Door systems and being able to report to funders how their investment into the ADRC No Wrong Door system is changing actual lives. Secondly, it's an opportunity for data to really help us identify community needs and the populations we serve by identifying any trends or service gaps. And then with that information, being able to open opportunities for growth. And some examples of that may be partnering with healthcare entities or partnering with other community-based organizations to better coordinate services for our consumers. And lastly, why is really using data to help drive action. The next question we're looking to answer is, why are we modifying the current reporting forms, or why have we modified the current reporting forms? Is to really, I think our goal from the very get-go, when we first implemented data collection for our ADRCs, I think a couple of years ago at this point, was really the main goal was to really demonstrate consumer outcomes. However, what we recognize so far is that what we've been collecting is really outputs. So what I mean by that is we've been collecting, service delivery data, the number of widgets, number of services that we provided to consumers. However, we haven't gotten quite to our goal yet of demonstrating consumer outcomes. And so with this past update, it's really that middle, we see this as kind of that middle stepping stone to really getting us closer to demonstrating outcomes from the data that we're collecting so far on outputs. Next question is, who were involved in the process? Throughout the process, we've been working closely with our ADRC advisory committee, specifically with our data and outcomes work group, to really develop this new data reporting tool and continuously enhancing it as we move along. Like Carol mentioned earlier, we actually do have members of our advisory committee as well as the data and outcome work groups in attendance to hear your feedback as well. We also received input and sample reports from some of our designated ADRCs. Thank you for those. You know who you are, that have provided us samples to consider and for enhancing our data collection. And lastly, like I mentioned earlier, we've involved the advisory committee, but we've also had plenty of other stakeholder input that were solicited as part of the update process. And so again, today's workshop is providing an additional opportunity to give more feedback and helping us continue enhancing our processes and tools. Last question, how were they developed? So I think, in a nutshell, it really all started with the development of logic models and really identifying the desired outcomes and using those to help identify key data points and measures that would be useful in assessing the impact of our ADRCs no wrong door systems on our consumers and their own personal goals and outcomes. As a result of those logic models, we've identified different program inputs, outputs, activities, different outcomes, such as immediate, intermediate, and long-term outcomes to help support really measuring and identifying whether we've made a difference in people's lives. There will be a later slide that has a sample logic model, and so we'll talk more about that later on. So with that, I think I'm turning it over to Amanda for our next slide.
Hi, everyone. Amanda Price here with the ADRC team at CDA. Just a quick visual description. I am Caucasian with blonde gray hair and middle-aged, and today I'm wearing a navy blue sweater and a navy blue scarf. So we wanted to share some highlights of the first quarter report for the fiscal year. The 6 designated ADRCs for the fiscal year 2021 to 22 submitted their first quarter data covering the time period of July 1st through September 30th of 2021. In the data report, only sections A, B, and C are required for data submission in the first quarter and the third quarter. There's additional data that we collect in the second and fourth quarters. As Wilson already mentioned today, the intention of these reports is really to demonstrate the value of the ADRCs in California. Next slide, please. So before we get into some trends that we observed in this first quarter report, we wanted to share some information about the report itself. So as I mentioned, all 6 ADRCs reported in this first quarter, and they all submitted at least some of the new data elements that were part of the new report for this fiscal year. The new data requested in the report covered a range of areas, and new data was reported in all 4 of the service functions for ADRCs. So just a side note, as I refer to ADRC service functions, and you probably know this, I mean the 4 main areas of service that ADRCs offer: enhanced information and referral, options counseling, short-term service coordination, and transition services. Another thing to note is that when ADRCs submitted their first quarter reports, many indicated they're still working to align and develop their systems for reporting some of the new data. And finally, the CDA team will be following up with the designated ADRCs to make sure we understand the individual reports submitted, and understanding a little more about those individual reports will help us understand some of the trends that we observed in the data when we summarized it. Next slide, please. So speaking of trends, we wanted to share some of the data and observations from this first quarter report. I'm showing a slide that is a chart comparing the number of reported consumers served by ADRCs from the first quarter of last year to the first quarter of this year for each service function. We also added as a reference the same comparison, but from the first quarter 2019 to the first quarter 2020. For enhanced information and referral, there was a 47% decrease from the first quarter 2019 to the first quarter 2020, compared to a 24% decrease in 2020 to 2021 first quarter. So based on this data, we could assume there was an increase in 2020 as the beginning of COVID created a need for more information. We could also maybe assume that there's a decrease in this past quarter 2021 as COVID vaccinations rolled out and the initial stage of the pandemic had hopefully ended. Every day is a new day though. For options counseling, there was an 8% decrease from the first quarter 2019 to 2020, perhaps as people were more focused on the day-to-day survival of the pandemic, and 169% increase from 2020 to 2021 as people began to do more planning for their futures. For short-term service coordination, there was a 3% increase for the first quarter in 2019 to 2020, which was moderate and potentially showed how coordination was required as we were in the midst of the pandemic. And then there was a 69% decrease in 2020 to 2021 as urgency had dissipated. And for transition services, there was a 26% decrease in the first quarter 2019 to the first quarter 2020, and 9% decrease from 2020 to 2021. So it's understandable that the transition services were not delivered as much during the early part of the pandemic as staff couldn't access facilities, but a decrease even 9% is still interesting now as adjustments to assure access to facilities and support systems have been put into place. So when we have more discussion time, it'll be interesting to hear your thoughts about these observed trends and assumptions. Next slide, please. The Q1 or quarter one service provision report has an optional narrative section to share challenges. So even though it was optional for Q1, some ADRCs still submitted information. And the trend in those narratives continues to show that ADRCs face ongoing challenges with the pandemic, especially in serving consumers through the main service functions. So this slide here shows a chart comparing the reported consumers served in the main service functions from the time period of July through September in 2019, before the pandemic even began, compared to this past fall when the pandemic was ongoing, that vaccinations, of course, have been available. In comparing the 2 years, it was interesting to note some of the differences. So reported consumers served by each service function were, for enhanced information referral, there was a 12% increase in 2021 compared to 2019. And options counseling, 146% increase in 2021 compared to pre-pandemic levels in 2019. For short-term service coordination, a 68% decrease in 2021 compared to 2019, and transition services, a 32% decrease compared to 2019. So again, more exploration and discussion of with these individual ADRCs who reported will help us understand these trends. But it's interesting to note that the pandemic may have played a part in the coordination and transition of consumers this time. Next slide, please. So continuing with one more observation from this first quarter report, here I'm showing a chart with the average number of consumers served by an ADRC in each of the 4 service functions for the past quarter. An average of 5,702 reported consumers for enhanced information and referral. An average of 1,391 reported consumers with options counseling services. An average of 427 consumers for short-term service coordination, and an average of 18 consumers for transition services. So we look forward to your thoughts and observations. And with that, I would like to introduce David Morikawa for the next part of the workshop. Thank you.
Thank you. I think both Wilson and I will be tag teaming this portion to have some open discussion. So we're just going to take a pause here and let us open it up for questions. We also do have members of our data and outcomes work group here, and you can ask them questions, or likewise, the members of the work group may wish to even ask the group questions as well. And so we do have some time here that we do want to make available for just some open discussion. So please raise your hands or flag us if you wish to speak.
Looks like we have 2 hands up. Brooke, Whitehead Tolls, and also Megan Granada. I think Brooke's hand was up first. Brooke, did you want to go and start off? Hi, Brooke. You're muted if you're talking. Oh, team, it sounds like Brooke cannot unmute. Can we go ahead and unmute Brooke, please? Any updates? She said I was.
Okay, now it's working. It went back and forth. Okay. I have a clarifying question for that last slide. So this was the numbers reported on average for ADRCs. Was this for all of 2021? Did you say the last quarter? I'm not clear on the data.
This is Amanda. Yeah, just the first quarter of the 2021-22 fiscal year. So July 1st through September 30th, 2021.
And then that leads me to my second question. I wonder if anyone else would be interested in maybe kind of a work group between the ADRCs, because I am curious in how other ADRCs are capturing their data. I know for us, we have 2 systems we're using, and then a lot of the data is hand calculated. And there's just some other questions about how to best have our staff record some of the data. So we know that we're providing a lot more services than we're capturing. And so for me, it might be helpful to talk to other ADRCs to see how are you capturing all of the services that you're doing.
Okay, thank you very much, Brooke. That is a good suggestion. We could try and do a poll on that later, or put your name in the chat if you do wish to have a group, so we could to notify you. But maybe we can even help arrange for an open discussion like that. We do know that everybody was having some problems with the collections of the data during the work group sessions and the development of the data. We did know that not our 6 designated ADRCs, none of the 6 was collecting all the data points. And so we did know there was going to be some additional work that was going to be needed. And that's why we wanted to kind of kick it off early and have everybody get started in there so they could actually see and identify where their weaknesses are, so we could have more, I think, more productive conversations on how we could get from where we were last year to where we want to be by the end of this fiscal year. Next question.
Great. I think our next question is Megan Granada. Megan, did you have a question? And are you able to unmute?
Yes.
Great.
This is Megan Granada from the Orange County ADRC. I know we've had some discussion offline about this report and the fact that it is a work in progress. So I'm hoping we can spend some time in today's meeting getting some feedback from the different ADRCs about what's workable and what isn't with this report. And I'm wondering, I think part of why we're having difficulty is that there are so many data points to collect. I was reviewing the data points earlier today, and there are 95 data points in the original report, and then additional 31 have been added to the new report. I'm wondering, is there consideration around reducing or streamlining the number of data points to make data collection more manageable for current and future partners?
Thank you, Megan. And that is, we do have members of our work group here. I know we went through almost 9 months of developing the data points that we did select. We do have a number of those that are in doing research and analysis, and many times they say the more data, the better. But at the same time, we were trying to limit it to as few as possible in order for us to hopefully keep the amount of time to collect those. But we are listening. We'd like to hear more about which areas you think are going to be very problematic, and then we could determine, what's the value of not collecting, what's the value that we may lose by not collecting that data. So that we're all listening for specific comments, and we'll have time as we go through each of those sections to help identify which ones you may wish to exclude.
So that, kind of food for thought, like David, just to kind of piggyback on what David mentioned is, are there any data points that you feel would be problematic to collect or doesn't make sense to collect? And is there any new ones you could think of? So those are things, think about that for a moment. Right now, I do see one, and feel free to raise your hand if you wish to share those. I do see Lana's hand up. So Lana, did you want to mute and say your comment?
Yes, hi Wilson. This is Lana from the Independent Living Resource Center, San Francisco. First up, a heads up to the coordinators who are gathering all this stuff and like collating it and stuff for all the different ADRC members. I think there's a couple of points. One of them is I think while I understand that data collection is really important, I also think on the part of executive directors and program directors, there's a lot of fatigue in terms of how much reporting we have to do. It's like every grant, every program, like I spend an enormous amount of time doing reporting, which I know is, part of the job of being an executive director, but also takes away some of the time that I could be doing some other really important like advocacy work. But in addition to that, I also think, and I think I probably speak for more than myself when I say, in terms of the data that it's collected, and I can only really speak in terms of like the IL, from the independent living centers, there's not really like one, we're not all working from one vocabulary. Like I even know within my center in the last year, like for us, transitions went sky high. Like we used to have 0 transitions. And it's only in the last 2 years that I've really started looking at how my staff are reporting, and they're amazing people and they haven't been trained in a long time. Most of them did SIL-Suite 10 years ago or whatever, 8 years ago. And I realized, because I'm so hands-on now with a lot of the stuff that goes into transition, that I'm like, wait a second, SIL-Suite is not recording. I have the records of all these people we helped transition. And then when I went back to staff, they're putting it in SIL-Suite as like, oh, this is a housing thing, or this is a, some other thing, or this is an AT thing. It's like, well, that's an AT thing. This was AT. We got somebody that facilitated a transition. We worked with Laguna Honda to make that happen. So we need to record it in that way. So I do think on the IL side anyway, and I've said this before at meetings of the independent living centers, that like, I think we could probably all do with like, I don't know how to facilitate it, but if we could all have the same vocabulary for our staff, so that, staff who are, to me, often underreporting. And I suspect that's true from every type of agency involved in an ADRC, because I know there's amazing work going out there. I just think there's underreporting happening because people don't often realize that something that may seem like a housing piece or an AT piece is also a transition piece, or even more often, a diversion piece. There's a lot of diversion stuff that just kind of goes under the wire that gets reported in another way, but doesn't get reported as a diversion. So I think there's that like there has to be a mutual agreed upon vocabulary for everybody who's participating, or else we're comparing apples and oranges.
Thank you very much, Lana. We do understand there are a lot of different vocabulary or use of terms in not just the ILCs, but also even within the AAAs, and so there is a need for that. It's in a way, it's also beyond the scope of this work group and this project, and so we do really want to see how we could work with the maybe Silk or with CFILC or with C4A to help us better identify how to define certain programs in certain areas. We also do know that in our reports that we're showing here, we're every number that we're showing is what was reported. We're not saying this is what it is, because we also know that there is a lot of underreporting going on, as well as some of our extended partners not reporting at all. And so we're just capturing what has been reported, knowing that there is a lot of underreporting or no reporting going on, as well as our report show is you do not collect. And so we're utilizing and considering all that information as we're further moving forward. Anything else any other questions? Those are all good questions. Is there anything from our work group that members that may wish to say anything at this time? And just curious.
I don't see any hands up from, I'm sorry, did I cut off somebody?
Letty is unmuted.
Megan's hands up.
Letty, did you want to say a few words? Not to put you on the spot if you accidentally unmuted. Okay, we'll move on. I do see Megan's hand up. So Megan, take it away.
Thanks. I was going to put this in the chat, but I think it goes well with, I believe, Lana's comment. I think having some of those definitions for the different core service components, like the service plan and the action plan and the goals, would be very, very helpful. And for us are necessary. David, you and I had just a verbal back and forth about what those terms are, but having that documented and making us able to refer back to those would be really helpful. Is that something you guys are working on or that you're considering putting together?
Yes, I believe we are. So we'll be talking about those as well today. Okay.
Thank you, Megan. And I did get a message from Letty. She was actually trying to talk, but not sure if we're able to hear her. Letty, did you want to try again to unmute and see if you're able to?
Can you hear me?
Yes.
I'm muted.
Yes, we can hear you.
Great. So I just wrote it in here, but I'll just say it out loud for everyone. So I'm Letty Zuno, by the way. I'm the chair of the data work group and also the executive director of Access to Independence San Diego Center for Independent Living. And I wanted to circle back on, I think Megan made a point that really intrigued me in talking about, I think you enumerated the different, I believe you said it was 90 and then 30 were added. And I'm gonna go on record and say, you know, I'm one of those people that I'm very data driven. And so the more data, the better for me. But I became very intrigued with your comment and would be really interested in hearing more about like the specifics of what exactly those data points are and what exactly it looks like as you're collecting it. There was somebody else that spoke from a Center for Independent Living and said, you know, from a collection standpoint, staff might be reporting. And so it does seem like maybe depending on the staff, or maybe it's training, or maybe it's the data collection system that's being used. That data is being collected also very differently from the ADRCs. So I think as a data work group, we'd be really interested with the group of ADRCs and hear directly of what it looks like on a day-to-day basis.
Thank you, Letty. And I think I do see Larry Wanger's hand up. Larry?
Hi, everyone. Can you hear me?
Yes, we can.
Great. I apologize. I'm on my phone. I had some computer trouble connecting. So a couple of random thoughts, and I apologize if they're not in a good sense of order. So I just, Larry Wenger with the Orange County ADRC Executive Director at Dale McIntosh Center. I too am a very data-driven person. I think in many ways we don't collect enough data, and the more the better sometimes, but at the same time, the data has to be useful and speak to the work that we're doing and be useful to everyone. I think there's a couple of thoughts that I have. First of all, I do believe it would be helpful. I know we have broad definitions, for example, about the 4 core service areas and some of those things, but I do think it's essential for staff training and consistency across the ADRCs that we have good definitions for the data points that need to be clarified. So Otherwise, what happens is those definitions are up for interpretation from one organization to another. So, is it enough to say, we want you to collect these 90 or 120 data points, but versus providing clear definitions so folks know what those are and know when they've done those things and are able to track that. The reality is that you're going to have folks counting things differently from one organization to another without that level of definitions. Just to step back though, I just want to I have a question and want to be clear about something. I'm wondering, I know that you have said, CDA has said, we understand if you can't collect all of these data points. Some clarity about when you do expect us to be able to collect all of these data points would be helpful. When we talk about not being able to collect a data point, what that really translates to is we're using a database that is designed to collect data for a number of other funders at our organization, but primarily state and federal entities, right? You've heard folks mention SIL-Suite. And so that is the package, or a similar package is what most ILCs are using. And certainly modifications to those systems can happen to design them to collect what we need. But I'm going to be real honest with you about, at least from my perspective as a center director, where we're at. Do we spend, the question becomes, CDA is talking about another data system that we may use as ADRCs. And so I'm hesitant to invest dollars into updating and making improvements and changes to our current data collection system to collect what you're asking us to collect, when in fact, a year from now or 2 years from now, we may be told, now you're going to use this system. And so I think those are, I'm speaking for myself, but I suspect there are other centers who may be in the same boat. I don't think any of us, I just want to be clear, nobody is saying we're not willing to collect this data. We want to give you the information you need to speak to the legislature. I want to be able to speak more clearly to our community in our outreach efforts about what the ADRC does. So we're on board with that. But there's just some broader logistical concerns that I think I have, and maybe others too.
Thank you, Larry, for bringing those up. Yes, we are trying to track what's going on with the other development of, I think it's called CHARM, and when that may eventually be decided upon and roll out. We do know that is not immediate. So in terms of that, we have no forecast for you at this time on that. So we need to move forward with this because our legislature is already asking for this information. And so we need to try and get ourselves as prepared as possible for when they do ask us for these reports. Second is, yes, we do need to clarify. We are trying our best to try and understand everybody's unique situations. And by the way, there are many unique situations, and we do encourage, as your staff works these out, to contact us, and so that we could hear how you're interpreting that, so we could try and work with everybody to try and keep our interpretations of these areas similar in our reporting. So I do understand that need and the need for the training for our groups. So we'll talk further, but I appreciate you also supporting the need for data in order for us to demonstrate what we do, as well as to be able to have our ADRCs be able to better monitor and better measure their own local services, and not just the state.
Yeah, and just to piggyback on what David said, I think what I've heard so far, a couple things. is some challenges is, what I'm hearing is different definitions between different funders and different data being collected with different definitions. And the second thing I hear is that each of our partners seems to have different systems, data collection systems that have different capabilities and different capacities. And so, and so with those two things that I've heard so far, what I've also heard, you have said so far is to, can there be like a coordinated, like a broad improvement efforts to address definitions and these different system capabilities? So, of one of them, at least for the different system capabilities, like David mentioned, we as in CDA in tandem with our DOR partners, we are looking into what David mentioned, our CHARM initiative or CRM initiative, we call it, basically looking for either a single database that are the AAAs and ILCs that are part of ADRC partnerships can use, or maybe have some sort of a bridge between all the different data platforms that our AAAs and ILCs are using. So we are trying to address at least that aspect on a more statewide level. In terms of the different definitions, we haven't, there isn't anything I'm aware of that we are doing to address that at the moment. So hopefully that answers your question, Larry. If not, feel free to unmute and ask any clarifying questions that you may have.
We do have Bridget's hand up, and then can we take Bridget's question, and then can we continue on with our agenda? So, because there will be another opportunity for additional questions at the end.
Go ahead, Lilibeth.
Oh, yeah. Hi, it's Lilibeth. Happy New Year. Since we're struggling with data, and it seems to me as a group, we're looking for some, like a bridge program that can unify all the data. Are you thinking, or do you have generic categories that define what could probably be in each of those categories, that all of the different ADRCs can identify in the different systems that they use, in preparation for that day when we have this glorious and perfect data system? So I was just thinking that maybe it would be helpful if CDA and DOR can create those, doesn't have to, well, an all-encompassing, well, erase that, categories that are defined that can help identify those parts that the different ADRCs can put under those categories. I don't know if I'm making myself clear, but it's like the outline of a Google map, right? So what would be, maybe it's already in the different forms. So so that when you ask for data, short of what the ideal tool should be, at least we have a list of categories that are well defined enough that would help us identify all the things that might be under that category.
All right, thank you very much, Lilibeth, for sharing that. Let's move forward, but our questions and period there did show a lot of challenges and clarifications that are needed. And so I know we had taken some notes, and I did hear several times a need for our local partners to get together And so I'll work with, if we want to utilize one of our webinar, Zoom or something like that, or somebody else wishes to run it, that's up, we just want to get together and come together, and so we can all move forward. But yes, we do want to have, we don't have a sunset clause on when everything needs to be collected, but we have pretty much just had a good faith timeline that everybody, all of our ADRC should be moving forward in terms of trying to collect these data points in the areas that they're having difficulty, to let us know so that we could look at how those things can be solved across the board. So, but we do like you to continue to try and move forward as best we can, and so possibly, as suggested, having a meeting with those that actually do the collection of the data can get together and hear how each others are doing it, to see if there's some tricks of the trade that can support each other. So appreciate that. If we can, let's move forward, and then we'll be hopefully then have time to go through some of these definitions that we have here today, as well as have another session on some questions. So on the next slide that we have, we can go to the next slide now. We just want to kind of talk about the logic models, and we're talking about outcomes and all, but for the past 25 years that I'm aware of, at least, United Way's foundations, grant makers, and everyone have been really moving away from the service delivery data, the collection of widgets, and have been asking nonprofits and agencies to start tracking outcomes or performance measures. And so this is, even the state is behind in asking for this data, but this is a good attempt for us to start moving in that direction. We want to know, and they want to know, what outcomes and what's the difference our programs are making in people's lives, and not just the number of people that we serve. So we have been, in the past, we've been, in a way, getting away with anecdotal information, good human interest stories, and all that. But now we need to have, as the state legislature has asked for, more measurable data to show that the true impact of our programs. So at the beginning, about over a year ago, almost a year, and in September of 2020, we started developing logic models. A logic model, what we started off was like a roadmap of what our, how people or how our consumers come into our system, how we support them with their directions, their interests, and their goals. And we actually develop like a roadmap, a logic model of how the inputs that we provide, the activities that are derived from those inputs, what are the activities that are created, and then trying to identify immediate, intermediate, and long-term outcomes from our activities, our outputs, and our inputs. And so we've come up with those. On the screen that we show here right now is a sample logic model that we were able to develop, and we utilized logic models from various like Ventura and Riverside, and we got input from a few other of our ADRCs on the development of these logic models. But it all starts with, for this example, the inputs. What are the investments that we put in, including the consumers that we work with? What activities are created from all those activities and services, or inputs and activities? And what impact does that have on participants? And what type of activities and what types of functions are needed to support our participants with the outputs? From there becomes immediate, or we call short-term outcomes, and then intermediate outcomes. Below that is what we also then identified as potential data elements. What are some of the key areas that we may want to consider that we should collect, into making sure that our inputs, our outputs, our outcomes are are working the way we think the plan should be working. And whether or not it could be in a report, whether that could be a survey, or how best to collect that data. And so we work these types of logic models out for our four core functions, transition services being here shown as a quick example, as well as for information referral, options counseling, and short-term service coordination. And this took quite a bit of time to identify the different steps, the different types of program activities that took place. How do people come into the program? What are the key measures that should be or can be tracked to determine where a person goes through the system? If we go to the next slide. So utilizing that logic model, we were able to include more data requests into our quarterly report forms. And I'm just going to go quickly through the sections of our report forms. But the section A is the first section, and technically there is no really changes in this form. It just wanted to share that the consumer demographics, which had age, ethnicity, consumer gender, sex at birth, sexual orientation or identity, as well as the consumer characteristics, those remain the same as the previous year. As we mentioned before, there is the do not collect button. We ask you that if you don't collect this information, fine, just check that box and we'll be able to note that you do not collect this information. If you do collect it, but the number is 0, please place 0 so that we know that you are at least trying to collect it, but it is reported as 0. In some places, and oftentimes we see them both blank. And so we're not quite sure if you're not collecting it or if the actual number is 0. And so that would be helpful for us to be able to understand where we are. But this form level, section A, hasn't changed at this time. And so there could be some questions down the line on how much of this do we need to continue to track, but we didn't touch this section at all. Okay, let's go to the next slide. So the section B is really then getting into the added survey, the added data elements that we have put together. In the past, we've really only asked for the number of people that entered into like information referral, either from the AAA or an ILC or other core partner or extended partner. And we ask that you collect those and share those, knowing that there may be some duplication of numbers, and that is okay. We're just trying to show, that this one person, they could have called all 3 or 4 or 5 different places, but your staff still accepted that call or still worked with that person. So we do know that there could be duplication, and that's just our reporting system for now. Some new elements that we did add had to do with the next ones, having to do with the initial intakes and assessments. Many times in information referral, people are just asking for a quick number. I just need a number for so-and-so, I need a number for this, I need a number for that. And you're not providing any kind of assessment or taking their information down or getting any intake information. And so we're trying to determine, of all the calls you receive, how many of them are getting further involved into really what we consider enhanced information and referral. Second, after that is total warm transfers, as well as I might as well add in the total service referrals offered and the total number of follow-up calls. All of those are part of our philosophy of being person-centered. And so these measures were also requested by our state legislature in being able to report. And so how we could do that better or easier, we're up to hearing how we can do that easier. But these are questions that we've been already asked in our program that we would like to be able to provide a good, fair response. Next slide. Options counseling. Again, we have this the total number of people identified as potential options counseling consumers. Not all, many times, actually wish to go into an options counseling function. And so that's why we just want to know if you have 1,000 people being referred for options counseling, but only 500 people actually wish to do it and start doing an initial involvement. Is that important information for you to know, for us to know? We thought it was, and so that whether the state or whether your own leaders are saying, hey, wait a minute, we have a 50% attrition rate in the number of people being identified and referred to options counseling. Half of them are not going into the program. Why is that? Is that because of what purposes? It provides the question of you know, how effective our programs are, since options counseling is one of our core functions. Again, we're asking here, in this one here, the number of warm transfers. Again, those are requirements that we're being asked to report. How many warm transfers are we providing in our programs? That is a key area of being person-centered and also providing no wrong door systems. Following that one is the total interviews and assessments. As I mentioned before, you may have 1,000 people coming in to do options counseling in a year, but maybe only 500, maybe 200. Is it important to know how many actual people actually come in? Or is it close to already 90% or higher that the first data is adequate for us to report that we could say predominantly all people that are referred for options counseling completes the initial assessments and interviews? The next one is, I think, is one of the areas that we had questions about, is total action plans. So a total action plan is usually what we thought, and when we heard and discussed it amongst our providers, is how many of our individuals actually agreed and actually developed an action plan to get them from where they are currently to where they wish to be, is in terms of their future direction. Normally there is like one action plan. This is where I want to live independently. I want to live in my own apartment. Okay, so that's your action plan, and you're writing that up. Let's go to the next slide. So the total action plans is usually, as I mentioned, is the consumer's action plan. This is what I want to achieve. Within that, they may have certain goals that they identify that they need to achieve in order for them to meet their option or meet their plan. And so the action plan is the larger plan, what they're focused, their overall plan to be in their future. And the total number of goals are the number of goals that they set or that are needed in order for them to realize their plan. And so that's how we define that in our options counseling program. And those are the generic terms that we heard when we were discussing options counseling. Now, you may be using different types of terms, but if you're able to use the same action plan, what is the overall plan and what are the goals associated with that plan, we would be able to better count apples to apples and oranges to oranges. And again, the number of follow-up calls, which is a trademark of our person-centered philosophy in our ADRC network. Okay, next slide, please. Short-term service coordination. somewhat follows the same logic or pattern of questions that we put together for options counseling. Again, it's the total number of individuals identified needing short-term service coordination. And excuse me. And this is really, there is possibly a definition we may need to clarify, because we do see some high number of variations in short-term service coordination. In our ADRC designation criteria, we refer to short-term service coordination as the urgent need to provide support to help a person remain out of a institutionalized type setting. And so this is very immediate coordination of services to keep them healthy and safe. And so we see some very high numbers, and then other areas some very low numbers, and maybe we have different interpretations of what people are considering as short-term service coordination, even like what Lana was referring to with transition services. And so we need to kind of measure that. But we do have total number of identified candidates for short-term service coordination. We don't know what that ratio is, and how many actually agree that they say, yeah, I need short-term service coordination. I'm willing, I want that, or I need that, thank you, or no, that's not for me. I don't need to share, all my information with you. I could do this on my own. So we have no bearing on how many people that are identified actually goes into short-term service coordination, and if there is a major difference. From there, we look at the total plans developed. In order for that person to develop wishing to do short-term service coordination, we need to have a plan. What is the plan for them to be able to reduce their chances of further issues, to reduce their chances of being institutionalized? So total plans developed, and then here's actions developed, which means what actions are needed in order to help that person maintain their core, to act within their short-term service coordination. Okay, next slide, please. And then the total action. So you can have one set of plans, and then you can have 3 or 4 actions. This person needs nutrition, this person needs transportation, this person needs assistive technology. These are all the things this person needs in their plan to maintain themselves independently. So that's how we refer to short-term service coordination. And again, the follow-up call is completed by the service coordination or by the ADRC contact person to make sure their needs are being met. Oftentimes, we also found that people don't know what they're going into. They may be going into options counseling, but then immediately finding out that their options counseling is longer term and they have more immediate needs in order to maintain themselves. So they could be actually reported sometimes in both, as both options counseling and short-term service coordination. And after they complete their short-term service coordination, they may then go back into options counseling. All right, let's go to the next one. And this is transition services. Again, follows the same similar pattern of reporting elements. The general term using, and again, we're using the general terms used in transition services, the ones that were reported to us. And if you use, if these data elements don't match your terminology, we ask you that you utilize these reporting mechanisms to report how you are classifying what you call service plans. But what we heard in transition services that you have transition service plans, and how you have to create a transition service plan, and then you actually have different actions that need to take place in order to support a person's transition away from a facility. and then the total number of follow-up calls, home visits, or other types of follow-up activities taking place. Went through those kind of quickly. And then this hasn't changed. I'm sorry, thank you. This one here hasn't changed. These are still the 4 areas that we are asking for specific information. If you are collecting those, how many transitions from a nursing facility, from a facility for individuals with intellectual disabilities, hospitals, or other institutional settings. And there are some methods to our madness and why we needed to select those for reporting purposes. Next slide. Okay. So just to clarify some of the reporting forms and things that, first of all, I didn't mention at the beginning, if you are not collecting information at this time, there is that do not collect at this time, do not collect button. Please be sure you push that or click on that one. If there is, you are collecting it, but there is zero information, zero data to report, actually write in 0. And this way we can include that information within our data report. And then the other area, I think well, let's go to the next. Excuse me. Okay, and the other area that we wanted to talk about was just understanding that options counseling. The overall plan is the action plan, and the steps to meet that action plans are called goals in options counseling. In service coordination, short-term service coordination, they actually develop a plan, and there's actions that needs to be completed in the plan. And in transition services, there's a transition service plan that has particular actions to be developed and implemented. So we'll write those clarifications down and help get those out within the instructions. So, okay. Well, let me hand this off to Amanda, so we could kind of wrap up this section, and then we could move forward with another open discussion period. Thank you very much.
Thank you. And just really quickly here, for future planning for the quarterly report, the Q2 report for ADRCs with designated status in this fiscal year will be due on January 31st. For the reporting period of July 1st through through December 31st, 2021, so it's cumulative. The same form will be used, Form 7029, and the form is located on our partners and providers website, but if you would like to receive it by email, please email adrc@aging.ca.gov. And as I mentioned before, there's some additional sections that are filled out in this second quarter report. And then in the future, we're looking to provide enhancements to the form and instructions for easier data reporting, such as a note section for ADRCs to give a narrative about their data collection if they would like to. And also we'll include some of the new data definitions that David has just discussed in the instructions. And then potentially we'll host new data workshops where ADRCs can discuss data collection. We see there's interest in that peer-to-peer interaction. So we'll see what we can do there. And next slide, thank you.
Great, I think it's turning back to me. So this portion is the second opportunity, like we mentioned earlier, for questions and open discussion. So if you have anything, feel free to put it in the chat or raise your hand. I do see Eldon's hand up. Eldon, would you like to unmute and mention your comment?
Yeah, can you hear me okay? Good.
Yes.
Thank you. I guess, David, have a question on short-term service coordination and your chart on that. I mean, a short-term service coordination could certainly be included in an options counseling plan, but the majority of that is provided Here's an example, we get a call from the hospital, somebody's being discharged, they need home delivered meals. That comes in, we make a referral to the home delivered meals program, hook it up, get it done, follow-up call, make sure it's happening. That's all recorded in the case file. There was never a plan. Same thing happens with transitions. For transportation. Somebody needs transportation to a medical appointment. We hook it up, we record it's happening, we follow up to make sure it did. It shows up in the case notes with that much documentation, but it was never included in a plan unless it was part of a person's option plan, IL plan for IL folks, and then it would be followed. But could you give some clarification on that? If we had to do a plan for every time we referred somebody to a service that was a short-term service coordination, kept them out of an institution, or they are having to stay in one much longer than needed, that would be pretty overwhelming.
Well, possibly with your more if you're trying to help them, transition from a hospital.
No, I'm not talking about that. No, that's not a short-term service coordination. That's a transition. Short-term service coordination. And here's an issue to help clarify for other folks too. Maybe all of our many of our partner agencies that participate and report on the ADRC form reporting system call different things by different names.
Mhm.
Our options counseling folks call it an IL plan. So what they've always traditionally called it is short-term service coordination for one agency, maybe home delivered meals, transportation. For somebody else, it may be a family consultation or setting up a caregiver. And what we've had to do is I've worked with each of our agencies for them to define for me and them, what is a short-term service coordination? So when they say that, I know it means this, and this, and that's what we report on. And if we're doing an options counseling plan and it requires home delivered meals then it's part of the plan and we would identify how we do it. But if it just comes in from the hospital, needs to be set up by the next day or two, we do it the way I described it. So I just want to, I hope, clarify that every time we address a short-term service coordination need, which is a lot of what we do a lot of the time, we don't get a plan. We just document what we did to make sure that person was referred to the right service, and we follow up to make sure it's working well. Now that's a case note, it's not a plan. So you want to come on, you audit, well, show me your short-term service coordination. We can pull those case notes for you to show you that it happened, but we have not done plans on it.
Okay, thank you. As I mentioned, there are some questions on short-term service definitions. I know we've been asking for short-term service coordination reports for the past couple of years, and we've been identifying that there are different ways people are identifying short-term service coordination. Some are taking it literally to helping someone avoid premature institutionalization of someone, and others are using a number of interventions or a number of plans that a person needs to, or actions that a person needs to resolve in order for that. So I've heard some places say if they have 3 or more needs coordination to reduce their chances of institutionalization, they define that as short-term service coordination.
So I guess in a way, this also comes under what others have asked for, and that's a clear definition of what these things are. I mean, some of them are pretty obvious, I would assume, to many of us, that and it could also, almost all of them could be included for diversion. If this person doesn't get meals when they come out of the hospital, then they will be institutionalized. I mean, just by definition, a number of these programs that we run, that's one of the outcomes if we do not provide short-term service coordination, transportation, meals, legal help, applications for benefits, and so on, or short-term interventions that prevent institutionalization, but also are counted as a short-term service coordination between the individual, the provider, and making sure it happens. Would you agree with that?
This is going to go back with the data and outcomes work group to help vet that through more carefully, because there are, what we do see is it is coordination. It's just not providing one service. There is what level of coordination is necessary to be determined as short-term service coordination. And I think that's the bigger question.
Yeah, and in our definition that we've used so far, that coordination is between the consumer and the provider. We facilitate that coordination and we make sure it works well, and the follow-up, of course. That's where we see the coordination takes place. It's not, and yeah, anyway, that's enough probably, but you understand my point, I would hope. Thank you. Thanks, David.
Thank you, Alden.
Uh-huh.
I don't see any hands up at this point. I do see a couple comments in the chat kind of supporting what Eldon had mentioned about, can we combine, some of these data elements or data points into a single data point. So like David mentioned, that's something we'll definitely take back, discuss with our ADRC advisory committee, specifically the data and outcomes work group, and go from there. I also see a comment about if we can share the data report in Excel format rather than a PDF. As some may have remembered, our first version, when we first started data collection, was Excel format, and then we converted to PDF in hopes of having it be cleaner and easier to fill out. However, if there are any issues with filling out the PDF document, if you can share those, that would be great for us to know. Rather than us creating the data report in a different format. So maybe Ben or Sarah, I think you had both mentioned an agreement on that. Is there anything you can share about the PDF formatting that we can improve upon? Okay, maybe not. Well, feel free to reach out if, feel free to reach out and we can kind of see, what we can improve upon. Any other questions? We still have some time, so feel free to raise your hand. I saw a hand raised from Rhoda and from Brooke. Rhoda, go ahead.
Hi, can you hear me okay?
Yes.
Yeah.
Awesome, great. So the PDF, what I've done, when I download it, I have Google Docs. So when I download it, I can transfer it into Google Sheets. Excuse me, not Sheets, Doc. That way it's like a Word doc and I can like edit it there and like add the numbers there if I like to. So it's not just on PDF and then save it back onto a PDF. That's kind of how I've been working with it and trying to play around with it from PDF to a Word doc. So instead of the Excel spreadsheet.
Thank you for sharing that. That's creative. Let's see. We also have a hand up from Brooke. Brooke, would you like to share your comments?
I have a question. I asked in the chat, but I'm not sure if y'all saw it. For newly designated ADRCs, when are we expected to report? Is it for the first quarter of the 22-23 fiscal year?
If you want me to, I could answer that question, Wilson. Is that right? So the congratulations first on
Thank
being.
You stressed us out, but.
But yes, the first report for the newly designated ADRCs will be for the first quarter of 22-23. So it'll be July through September of 2022. That will be due at the end of October.
Perfect. I just wanted to confirm. Thank you, David.
That gives you a few months here to start looking at those forms. We did ask you to take a look at it and provide a sample of your reporting capabilities. And so you should have a good idea of what the reporting expectations are. So hopefully that helped.
Yes, thank you.
I didn't know if I do see Letty still here, and I don't know if there's other members of our data and outcomes work group here, but I didn't know if Letty, if you wanted to add any remarks or input here, since we're working on all this together.
For all of the feedback. Everything that everyone has shared is very enlightening, and so my brain is going 100 miles per hour. And definitely taking it all in and taking this all to see how this can be condensed, be made more fluid while still obtaining the information, the data that is needed. All of so language, right? The language is really important. We use ILPs, and I heard people saying, well, if you have a plan, what's the difference between the plans and the goals? And I agree with all of that. So I'm really grateful for all of the feedback. Thank you to everyone.
Great. Thank you, Letty.
One other thing that we did learn through the first report that was submitted to us was that more dialogue is needed between our ADRCs and the report form. And I know we contacted several of you asking for some explanations of your data collection, but we need to do much more of that to get a better understanding of the data that you are reporting. So we're making a commitment to do that, and appreciate that very much.
So I think I see one more hand from Megan. Megan, would you like to unmute and ask your question or comment?
Yeah, last question, I promise. First of all, thanks so much for having us all here. This has been helpful and I think is a step in the right direction. My question is about the statistics that were shared earlier, and specifically the decrease in transition services was notable for me, but not surprising. As someone who does transition work, I have a couple of ideas why that might be happening, and specifically now. Is that, what was your reaction to that? And is that something that CDA is planning to address?
I think we just noted that was surprising to us too, and we're trying to hear more what the field input is on that trend.
And just kind of piggyback on that, and it may not just be California. I have to kind of look back in my notes and conversations at the kind of nationwide level, but we've had discussions before about transition services, and I want to say that in some states, transition services are also down when ideally, especially during COVID, it should be up, right? Because we want to support more people, being able to get back home safely in their own homes or in their families' homes versus in a nursing facility, especially in the beginning of COVID. So, I think just to answer your question, I think it was surprising, but also at the same time, not that surprising to us. And, looking forward to hearing any feedback that you may have, Megan, perhaps in a future session about how, what are the issues you're seeing in your community, and also how can we in California address those issues to increase the amount of transitions again. Thank you for that. So recognizing that we have 4 minutes, I'm gonna go ahead and turn it back, I believe, to my colleagues to help wrap things up for next steps and wrapping up with our contact information. So with that, is it Carol? Is that you up next?
Yes, thanks, Wilson. Again, this is Carol DeAndres. As we're wrapping up our workshop, here's what you can expect from the ADRC team in the coming months. We will update the instructions, the report forms. This is form number 7029 and 7029I, based on the feedback we've received. You should have already received the draft consumer experience survey form that we sent out December 30th. So please share your input and feedback to us by February 9th. We'd appreciate it. And now we're going to launch a quick Zoom poll to evaluate today's workshop and help us with future planning. So Mylene, if you can launch the poll, that would be great.
We have one other thing, Carol, that was mentioned here today. We have some follow-up questions, and we also will see if we could set up a Zoom call for those wishing to get together to discuss data collection methods in their ADRCs.
Yes, absolutely.
Thank
Thanks.
you.
Thanks, David. And if you want to launch the poll, Mylene.
Thank you.
So it's just a quick poll. How would you rate today's workshop? Scale from 1 to 5, 1 not being good, being not good, and 5 being very good. So, and number 2, would you like to see ADRC data workshops scheduled in the future? Yes or no? And I think from David's comment is yes, we'll be getting together, but please, if you have any other ideas, please put them in the chat function. And I think we're good, 100% answered. Okay. Next slide. You can close the poll, Mylene. And we want to say, next slide with our contact information. There we go. Thank you all again for joining us today. Remember, we are available. The ADRC team is available to answer your questions and provide technical assistance. So please reach out to us anytime. This is our email address, adrc@aging.ca.gov. And of course, monitor our website, CDA website, www.aging.ca.gov. And then for the ADRC webpage, click on Providers and Partners, and then click on Aging and Disability Resource Connection. Again, thank you for your participation today and your feedback. And on behalf of CDA's ADRC team, we wish you a happy new year. Take care, everyone. Thanks again.